going on, my beautiful kings and queens? My name is Jamila Ashley and welcome back to my channel. Y'all, thank you so much for subscribing. Thank you for viewing. Thank you for liking. I'm hearing you guys and I'm listening to everything that you guys are saying. And I appreciate the love and support starting out this far. Today's video, we're going to be talking about the early stages of therapy. I'm not going to get into it too deep, but I just want to talk about how you research in finding a therapist, what to expect when you first walk in the doors of a facility, and what to expect from your first therapy session with your therapist. So that's the things we're going to be talking about. But before we get into that, don't forget to like, comment, subscribe, and share, and also turn on that post notification bell so you know when I'm uploading another video. All right, once y'all do that, then we can get into it. All right, so do that and let's get started. Talk about the early stages of therapy and what to expect from it. A lot of people don't know how to research a therapist, don't know what to expect when you walk into the doors of an office, of a facility. You know, you're kind of nervous. What do I expect, Jamila? And then what do I expect from my first session with my therapist? So I'm going to be talking about those things right here. So step one. Researching a therapist. Let's say for instance, you have insurance. What you can do is you can look on the back of your insurance card. There's a 1-800 number. You can call that 1-800 number and talk to a representative. A representative can give you a better understanding of where to go and to find a therapist. If you don't want to go that route, you can also do just a random Google search. So say for instance, you have Blue Cross Blue Shield, Humana, Aetna, anything like that. Just put it in the Google search bar. Therapists in my area that accept Blue Cross Blue Shield. Therapists in my area that accept Aetna. Therapists in my area that accept Medicaid. So then you'll start to see a list of therapists that may accept your insurance. And majority of the time, therapists have profiles, Psychology Today profiles. So you can look and actually read and see if they actually accept your insurance. So if you're still unsure, you know, make sure you read, make sure you understand things that they accept. So that's one method. If you don't have insurance, because some people are like, Jamila, I don't have any insurance, I don't have good insurance, I have a lack of income. We in a pandemic, a lot of people have lost their jobs and have lack of income. If that is you, there are still places that accept people that do not have insurance or that have a lack of income. I worked in an outpatient facility where we accepted people that were homeless. Homeless people didn't have insurance. They didn't have a job, or they were looking for jobs. They were trying to get a job that had insurance. We still saw those people. Now, I'm going to give it to you straight and real. Some places like that, not all, because I've only worked in one, some places like that can be overcrowded because there's a lot of people that do not have insurance. So there's more people that do not have insurance versus people that do have insurance and that have income. So when you go to places like that, sometimes your therapist may not be as accessible. So for me, I saw people on a weekly basis, sometimes 2 times a week, sometimes 3 times a week. But, and here's the downfall to the but, it was in a group therapy session because there was so many clients to see and not enough therapists. And we wanted to be able to see everybody, but we couldn't do that on an individual basis. That means nobody would get seen for probably months at a time. So we had to do it on a group therapy session. Now some people are like, Jamila, I'm not doing no group therapy. Listen. Group therapy is very beneficial to therapy rather than individual therapy. Individual therapy is still effective, but group therapy is much more effective because you're with people that are struggling with some of the things that you're struggling with, or may not be struggling with some of the things that you're struggling with, but you can also learn from your peers, from your counterparts. And that's what the benefits of group therapy are. Nobody is expecting you to go into group therapy and divulging your entire life the first day in group therapy. That's not how it works. And yeah, you'll probably be very nervous and very apprehensive the first time you go into a group therapy session. But I'm telling you, I've seen some amazing things come about group therapy because now they have a support system. A lot of the times people come into therapy, they don't have a support system, or they feel like they have a lack of a support system, because you're coming to therapy to, talk with somebody and get some feedback about your own life. And sometimes you can't get that from your family or your friends. What better way to get that support than in a group therapy session? So just think about it. Just think about it. I ain't gonna steer you wrong. Just think about it. But that is one of the downfalls of going to places that do accept people that don't have insurance, that do accept people that have a lack of income, is that it may be in a group therapy session. Now, I did see some people on an individual basis, but it wasn't as consistent. In therapy, you want to be very consistent. So the ones that I saw in group therapy, like I said, I saw them twice a week, 3 times a week. Those are the same faces I continue to see. The people I saw on an individual basis, maybe I saw them once a week, and that may be okay. Maybe you just need once a week, and that's fine with you. But don't look, I'm telling you, group therapy, don't write it off just yet. It is beneficial. But like I said, there are just a little downfalls into going into places like that, but it still is effective. There are still great therapists in these places, and you can get really good, effective therapy from places like that. So, insurance versus no insurance, income versus no income, there are still places that will take you if you have insurance or if you don't have insurance. So that's the first step. The second step. So you found a place, you feel really good about it, and you're ready to take that step into finding your therapist. So what's going to happen typically is when you go into a new facility, you're brand new, nobody knows anything about you. I expect carve out maybe 2.5 hours of your day, because it's going to be an assessment part. So the assessment part takes a little bit more time than just a regular therapy session, because the administration, they have to get your paperwork. If you have insurance, they got to run your insurance. They got to get your demographics. They got to do all this paperwork. It's going to be like you're signing up to buy a car. I'm telling you, you're going to be sick and tired of doing paperwork. So just expect to do that, because you're going to do paperwork, which is going to take some time. And then you're going to be assigned a therapist to do your assessment. Now, Jamila, I said I want to find a therapist. Hold on, there's a process, okay? So you have to get an assessment done first so that you can be recommended for therapy. So then when you get into a facility, you do your paperwork, then you get scheduled for your assessment. Your assessment comes after your paperwork. You go into an office, you speak with a therapist, and this very may well be the therapist that you're going to see on a regular basis, or they could recommend you to another therapist. So you do your assessment. Well, Jamila, what is an assessment? So an assessment is a tool that therapists use that are loaded with a bunch of questions. So I will say this, that you're going to be asked a bunch of questions. It may bring up some past trauma, some old behaviors, some old thoughts that may be triggering in this process. Please be very, very transparent with the person that is assessing you, and let them know, like, hey, I can talk about this, but only on surface level. I can't go too deep, because now I'm going to be triggered into my trauma. We understand. We definitely understand. We'll make note of that this is a triggering process for you, and maybe they can talk about this later in a regular therapy session. So it's going to be a bunch of questions. Typically, it's going to be about why you're here, what you've been struggling with, your past family history, your past childhood history, any substance abuse or addiction, any past trauma, anything from your past we're going to ask about, and anything current. What are you currently struggling with? How's work? Do you have a job? Are you employed? Ever had a criminal history? So it's a lot of questions, and they can be invasive to some people. I'm like, why are you asking about my criminal history? Trust me, it all makes sense at the end. So once you do your assessment, typically you may get diagnosed with a mental health disorder. Sometimes you don't have to. You don't have to be diagnosed with a mental health disorder. If you do get diagnosed, it's up to that therapist to explain what that diagnosis is, especially if you've never been diagnosed with a mental health disorder before. So that's the time that your therapist, the clinician that assesses you, explains what your diagnosis is, and how you can go move around it and about it. But you'll learn more about that in your regular therapy session. They don't want to take too much time and kind of going into the history of what the diagnosis is. You will learn about that with your regular therapist. So you'll learn about your diagnosis, mental health, and addiction. So if you have a substance use problem and they diagnose you with a substance use disorder, they'll talk about that as well. But like I said, you will talk about that in regular therapy. Next, they will talk about a recommendation. Like I said, the therapist that assesses you may be the therapist that they're going to recommend you to. Or they may work in an office with other therapists. They're like, okay, I think you'll fit best with this person. But this is also the time for you to explain to that therapist, I need a female. I need that female to be of this race. I need this female to be A, B, C, and D. Because this is your time to be able to express who I'm going to feel comfortable with talking with. So that's your time to express to that person who I really want to be my therapist. So once you guys figure out those things and the kinks, then you get scheduled for your regular therapy session. So that day is over. Day 2, I think, or step 2, I think is probably the most difficult part in starting therapy, because like I said, it's a very quick process into delving into a lot of trauma and a lot of old behaviors, and a lot of people do not like doing that. So that's step 2. Step 3 is your first therapy session with your therapist. And I'm only going to talk about this briefly. Your first therapy session with your therapist is where you start to build your therapeutic relationship with the therapist. Sometimes therapists, that's the time that they take to do your treatment planning. Your treatment planning is your therapist asking you, what goals do you want to work on? Why are you here? What can I help you with? These are goals specific to you. This is your therapy session. This is all centered around you. So you decide what goals you want to work on, what things you want to work on over the course of months to maybe a year. But these are specific to you. Your therapist wants to get to know who you are, the person you are, and what goals you want to work on while you're in the session. That's going to be your first therapy session. Learning about you and why you're here. That's when the therapeutic relationship and the trust hopefully begins to gain from that first session. Trust will take time. It's not an open door, hey, I'm about to come and explain everything that's going on with me in my life. We don't expect that. We don't expect for you to delve into everything on the first day. But we do want to start to build that trust with you, that relationship with you, so that we can get into those heavy subjects. That's going to take some time, especially if you had trauma in your past and, things that you had not discussed in so long. It takes time. So give yourself grace. Give yourself an opportunity to process this new journey you're about to be on, because it takes time. So give yourself grace. And that's pretty much the only thing I can say for people that are coming into a new therapeutic setting. Give yourself some grace, okay? Like I said, I wasn't going to get into this too much. I can also talk about, what to expect on the journey and other things like that. But this is where I wanted to end it here, just to get you jumped into what to expect from therapy. Any questions, leave them down in the comments below. I will be addressing any questions. You can also DM me on Instagram. Follow me on Instagram. That's where I'm heavily active the most. Follow me on TikTok. And yeah, so just follow me on my social media platforms. Don't forget to like, comment, subscribe, share with your friends, turn on your post notification bell, and I will see y'all later.